Good evening to everyone and welcome to this wonderful session for the preparation to staff nurse exams. Whether you are going for Telangana exam or Kerala exam or Gujarat or Delhi or Ames or any exam. There are 14 subjects that you need to master. Very happy to see Mamata, Archana, Rama, and many more who are all online. So every day for a couple of hours, we have this session. Can the online students can punch whether the voice is loud and clear for all of you, sister? So basically, any nursing exam, 50% questions come from medical and surgical nursing. Can you please punch into the chat window whether my voice is loud and clear for all of you, please? So, medical surgical nursing is the most important subject that you need to master. 50% questions come from that. Fundamentals of nursing, nursing management, anatomy, physiology, biochemistry, microbiology, they're all the other small things. I will be giving you 300 pages notes when you come to the center. And every day we will have a 2 hours discussion. So with that, I make the start of the session. So thank you, Rama, for the feedback that the voice is loud and clear. Great. So let us make the great beginning. Yeah, very nice to see Rani, Israel, and many more who are all online. Very good, very good. Rani, are you able to hear my voice, Rani? Can you please? Yeah, you can unmute your mic and tell me, Rani and Mamta, are you able to hear my voice clearly? You can quickly unmute the mic and tell whether you are able to listen my voice. Rani, Mamta.
Yes.
Very good. So, yes, let's make the great beginning. Okay. Acquired immunodeficiency syndrome. All of you know, it is called AIDS. AIDS is caused by HIV, which is human immunodeficiency virus. What is the class to which HIV belongs? It is called retrovirus. It has RNA as a genetic material and it makes DNA from RNA. Now you need to know one point. DNA is deoxyribonucleic acid, RNA is ribonucleic acid. From the DNA, all your genes, chromosomes, everything come from DNA. From RNA, proteins are formed. In RNA, there are 3 types of RNA. Transfer RNA, tRNA, mRNA, which is messenger RNA, and rRNA, which is ribosomal RNA, is what you need to remember. So normally, RNA forms from DNA. But what is the meaning of retro? Retro means reverse. In HIV, DNA forms from RNA. That is the reason this is called retrovirus, is what you need to remember. Now, yeah. So, HIV or AIDS, what is the main problem? There are helper T cells. Their number will come down. So what is T cell? What is a B cell? What is a lymphocyte? What is its function? Normally, a lymphocyte is like a police. It will protect you. It will protect you from getting affected with viral infections, bacterial infections, etc. Suppose you get HIV, then it directly goes and affects that police only. So the number of lymphocytes will come down. Now, once more, there are two types of lymphocytes. One is called B lymphocyte, other is called T lymphocyte. B lymphocyte become plasma cell form antibodies. T lymphocyte, there are two types, cytotoxic T lymphocyte and helper T lymphocyte. Cytotoxic T cell directly goes and destroy the virus, bacteria, and etc. Then there are helper T cells which will help the cytotoxic T cells to kill these viruses. So what is the problem in AIDS? Typically, HIV comes and damages this helper T cell. Then there is nobody to help cytotoxic T cells to go and kill virus, bacteria, fungi and all. That is the reason in HIV there is more infection with virus, more infection with bacteria. They're all called opportunistic infections. What is the meaning of opportunity? Mauka. Mauke mein chauka. So, opportunity means normally Candida will not cause infection. Unless you have diabetes, you will get candidiasis. Normally, Candida does not cause infection. Unless you have HIV, your T lymphocyte is compromised. Then only you will get Candida. So, Candida is called an opportunistic infection, is what you need to remember. HIV will go and infect any cell which has a receptor called CD4. CD4 receptor. So what are the other cells which have a CD4 receptor other than helper T lymphocyte? Monocyte also has CD4. Macrophage also has CD4. In the skin, you have dendritic cells. They have CD4. In the brain, you have microglial cell. It also has CD4. All these cells are affected by the HIV, is what you need to remember. Good to see.
వాళ్ళు ఫుల్ క్లాసెస్ అటెండ్ అయింది కవితక్క జ్యోతక్క జర్మికక్క ఆర్ అటెండ్ ఫుల్ క్లాసెస్ లాస్ట్ previous 2 months back. So now they are neglecting me.
So good to see Sham Unisa, Mamata, Israel, Archana, and everybody who are all online, and also Rama and everybody. Very good. Rama, am I clear? Am I very fast? Is my speed okay? Please let me know. Please give a feedback so that accordingly I can decide the speed. So, sister, what are the other types of cells which are also CD4 receptor cells, containing cells which are destroyed by the HIV? Monocyte, macrophage, dendritic cell, microglial cell, all of them. Tomorrow, staff nurse exam, they will definitely ask one question on HIV and AIDS. You have to be very sure. So, what is the normal lifespan of a T cell which is not infected. 100 days it can live, T lymphocyte. But if it is infected with HIV, it will die within 2 days. That's a point you need to remember. Very nice. Thank you, Rama, for the feedback. It is clear, sir. Excellent. So what is the normal value of these CD4 T cells? How many CD4 plus helper T cells will be there in our blood? From 500 to 1200 cells per ml is a normal number. So don't forget, the normal lifespan is 100 days, but if HIV infected, lymphocytes will die within 2 days. So once more, you should remember B cell, helper T cell, plasma cell which produce antibody, and memory B cells. So this is how a T cell become infected with the HIV. So the HIV will be coming, the virus. Here is the T cell, it got infected, HIV enters into the cell, it will copy itself. From RNA, it can produce DNA. That's the reason it is called retrovirus. And it will multiply within the T cell, and the T cell is destroyed and the babies are being released. That is how HIV invades the T cell. So T cell binds with the macrophage, and macrophage the T cell is activated by the macrophage and it becomes the helper T cell. Helper T cell activates cytotoxic T cell. This is also called killer T cell, and that will go and kills normally the infected cells. But what happens if at all this T cell is infected with HIV? If it is infected with HIV, it cannot activate killer T cell. That's the point you need to understand. Now, AIDS, when the disease progress, the CD4 plus T cells decrease. Yes, CD4 plus T cells decrease. The immune system remains healthy. When will it be healthy? How much CD4 count is required? At least more than 500, then it is very healthy. Whenever it is between 200 to 500, a lot of problems will start. When it is count is less than 200, then the person is completely immunocompromised. So normally, what is the ratio of CD4 to CD8? CD4 divided by CD8 is equal to 2:1. For every one CD8 cell, there are 2 CD4 cells. But this ratio will decrease when the HIV undergoes progression, is what you need to remember. So, HIV, how is it acquired? Commonly, it is the sexual intercourse with the infected person. Similarly, when you are managing blood bank, any blood infected exposure to that blood of a HIV infected person can cause transmission. The mother can transmit it to the baby. It's called perinatal transmission. That's the reason. Not like. ఇక్కడ ప్రాబ్లం ఉన్నా అనుకున్నా. So how is HIV transmitted? Sexual intercourse, exposure to blood, perinatal, that is from the mother to the baby, any body fluids, exposure to semen, vaginal secretion, saliva, cerebrospinal fluid, tears, anything can cause. That's the reason kissing a HIV person can also lead to the transmission because of the saliva. Similarly, sharing of the needles, sharing of the razors, anything can cause the transmission of the HIV is what you should remember. So, one very important thing you need to know. This is one of the favorite question of the examiner. Tomorrow, staff nurse exam, they will ask the question. When the CD4 count falls below 500, which infection occurs? You should know. TB is more in HIV, and HIV, TB worsens HIV, HIV worsens TB, both of them. Bacterial pneumonia, herpes zoster, candidiasis, Kaposi sarcoma, non-Hodgkin's lymphoma, they're all common once it is less than 500. The moment the count goes less than 200, then not only oral candidiasis, even into the esophagus candidiasis occur. Pneumocystis pneumonia occur, herpes simplex ulcer, then dementia because of the HIV. Because of the HIV, person loses all his muscle. It is called wasting syndrome. Typically, wasting syndrome can occur. So these are all the problems that happen with the HIV. Similarly, once it is less than 100, then cerebral toxoplasma, cryptococcal meningitis, cryptococcus sporidiasis, microsporidiasis, mycobacterium avium infection, anything can happen. Once it is less than 50, CMV infection, mycobacterium avium complex, toxoplasma, any of these infections can occur. So, what is the favorite question that you need to buttify for the tomorrow's staff nurse exam? They are going to ask a question. Ravali, please, you can directly log in through the YouTube account, YouTube link, right? So those who could not log in through this link can come through the YouTube link. Very good to see 4 online in the YouTube. Very good. So you should remember and buttify this very important fact. Which infections occur at what level of the CD4 count? Now, in the HIV, there is something called primary HIV infection. So, primary HIV infection means the moment HIV is infected, the person will develop, initially he'll be asymptomatic. Before becoming asymptomatic, he will have, just like any other viral infection, he will have all the body pains and all that. After that, he enters the clinical stage 1, then clinical stage 2, then clinical stage 3, and clinical stage 4. Now let us see in each of these clinical stages what happens in HIV. In each of the clinical stages, what are the important changes that occur in HIV? Let us look into them. There is a persistent generalized lymphadenopathy. Lymphadenopathy means enlargement of the lymph node, generalized throughout the body. Then in the stage 2, there is a weight loss, recurrent oral ulcerations, recurrent respiratory infections, herpes zoster. What is meant by herpes zoster? In childhood, we get chicken pox, no? Chicken pox, chicken pox. In Telugu, we call Ammavaru. So, chicken pox typically will remain in the body latent, and when you become old, when you are immunocompromised, when you get diabetes, once more it will reactivate. That is called herpes zoster. So herpes zoster and chicken pox, both of them are same. In childhood, what you get chicken pox become herpes zoster when you become old, is what you need to remember. Now, sister, angular cheilitis, typically on the side of the mouth, there is lot of fissuring. Fissuring means it'll breaks will be there. Angular cheilitis. Pruritus means itching. Itching eruptions will be there. Seborrheic dermatitis. I'll show you some pictures, clinical pictures of that. And fungal nail infections. They're all the features of the clinical stage 1 of HIV. So what is this? These are all the herpes zoster. In childhood, this is called chicken pox. In adults, it will typically occur in one particular dermatomal segment. So basically, the skin is divided based on the nerve supply into dermatomes. Only one particular dermatome it will be there. That is a characteristic feature of herpes zoster. So herpes zoster can involve in the distribution of trigeminal nerve. Entire face sensory supply comes from trigeminal. Only place where trigeminal does not supply is the skin on the angle of the mandible. There it is supplied by the great auricular nerve. Everywhere else it is a trigeminal. The cranial nerve trigeminal supplies the sensory supply. All muscles of the face, they're all motor supply is by facial nerve. The only muscle which is not supplied by facial nerve is levator palpebrae superioris. Palpebrae means eyelid. Levator means elevate. Our eyelid is opened and elevated because of this levator palpebrae superioris. It is not supplied by facial nerve. It is supplied by oculomotor nerve, which is the third cranial nerve is called oculomotor nerve. That supplies levator palpebrae superioris. So all other muscles of the face, motor supply comes from facial nerve, is what you should remember. Okay? So, yes. That is the story of the primary HIV. So this is one more example where the patient developed herpes zoster. Herpes zoster can involve the eye. Then it is called herpes zoster ophthalmicus is the name which is being given to it. This is another example of chicken pox in childhood become herpes zoster in adults. Please remember, herpes zoster is different from herpes simplex. Herpes simplex is different. Herpes simplex means on the lip you get a lesion, that is herpes simplex. Similarly, in the vagina there can be herpes simplex, that is different. This is herpes zoster. Zoster is chicken pox, is what you should remember. Now, what is the third stage of HIV? There's a severe weight loss, more than 10% body loss. HIV patient will be having buckets and buckets of loose motions, chronic diarrhea more than 1 month, unexplained persistent fever. Persistent means constant fever, longer than 1 month. In the mouth, white oral candidiasis. In the mouth, there will be oral hairy leukoplakia. Leuko means white. White lesions in the tongue, which are hair-like. That's called oral hairy leukoplakia. Pulmonary TB, bacterial infections. Similarly, stomatitis, gingivitis, periodontitis, unexplained anemia, neutropenia, neutrophil count goes less than 500, thrombocytopenia less than 50,000. They're all the things that happen in the stage 3 of the HIV is what you should remember. So this is an example of a severe wasting. More than 10% of the body weight is called stage 3. Then you have stage 4. Stage 4 is HIV wasting syndrome, pneumocystis pneumonia, Kaposi sarcoma. Similarly, esophageal candidiasis, HIV encephalopathy, extrapulmonary TB. Outside the lung, there will be development of TB. There is a toxoplasmosis. There is cryptococcus infection leading to meningitis. They're all the things that you see when they reach the stage 4. So all these HIV lesions, what are the infections that occur in HIV? You have to be very sure, sister. So this is what? Kaposi sarcoma. So these red colored fleshy lesions are called Kaposi sarcoma, which you see in HIV infection. This is another example of a red fleshy lesions, which is called Kaposi sarcoma. These purple nodules that you see are called Kaposi sarcoma. Kaposi sarcoma can even occur in the mouth, which can be seen in HIV. Once HIV patients reach stage 5, what will happen? There are many mycobacteria. TB is because of what? Mycobacterium tuberculosis. There are some other mycobacteria called Mycobacteria avium intracellulare. Mycobacterium avium intracellulare. So these are called as non-tuberculous mycobacteria. They become very severe once the HIV patient reaches stage 5. Ultimately, brain get affected because of HIV, that is called multifocal leukoencephalopathy. And there is an infection that leads to a lot of loose motions called isosporiasis, cryptosporidium. There are the 2 infections that lead to loose motions in HIV positive patients. Then there will be cytomegalovirus infection, nephropathy, kidney get affected, cardiomyopathy, heart get affected with HIV. So what is this, sister? This is cytomegalovirus. CMV can cause retinitis in patients who are having HIV. So this is another example of CMV, which can cause retinitis in HIV. Patients can develop non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma when they develop HIV. This is another example of a patient who developed non-Hodgkin's lymphoma when there is HIV. And HIV can cause lymphoma in the brain. This is called AIDS-related lymphoma in the brain. Now, how do you diagnose HIV? So today we finished this topic of HIV in medical surgical nursing. Can you please punch Rama, Archana, and everybody, whether Is my voice loud and clear for all of you? Please punch. So, what are the diagnostic tests for HIV? We do ELISA. What is the full form of ELISA, sister? Enzyme-Linked Immunosorbent Assay. It is for screening. Then to confirm, what do we use? Western Blot test is used to confirm. ELISA is done for screening, is what you should remember. Then we regularly monitor the CD4 count to know the progress of the HIV disease. Now there are some drugs which are used to treat the HIV. They are called antiretroviral drugs. Now what are those antiretroviral drugs that we use? Nucleoside reverse transcriptase inhibitors. There are some classes of drugs you should know. One is called nucleoside reverse transcriptase inhibitor. Other is called, they are also reverse transcriptase inhibitor only, but they are not nucleosides. What are nucleosides? Adenosine, guanine, cytosine, uracil, thymine. They are all what? The basic building blocks of your DNA, right? Adenine, thymine, uracil. So, nucleoside reverse transcriptase inhibitors means ultimately HIV, what is the main enzyme that makes HIV so dangerous? It has a reverse transcriptase which converts RNA into DNA. So we have to inhibit that reverse transcriptase. How can you inhibit that? Either you can use a drug which looks like adenine, guanine, thymine, cytosine, or which don't look like adenine, guanine, thymine, cytosine. Suresh? So two types of drugs you need to know. So accordingly, you have nucleoside which look like adenine, guanine, cytosine, thymine that inhibit reverse transcriptase, or non-nucleoside reverse transcriptase inhibitors. There are two types. Okay. So commonly tomorrow's nursing exam, they will ask you. Tomorrow's exam, they will ask you. Thank you, Rama, for the feedback. It means a lot for me. So, abacavir, diadenosine, emtricitabine, lamivudine, stavudine, tenofovir, zidovudine, they are all called nucleotide reverse transcriptase inhibitors. Then what are non-nucleoside reverse transcriptase inhibitors? Dilaverdin, doravirin, ifavirenz, nevirapin, rilpivirin. These are all called non-nucleoside reverse transcriptase inhibitors. So you should remember how the various antiviral drugs which are used to treat the the HIV infection, how do they work? So basically, you have some of the inhibitors which are reverse transcriptase inhibitors. They can be NRTIs or NNRTIs, that is non-nucleoside reverse transcriptase inhibitors. So once HIV virus enters, it will release viral RNA, reverse transcriptase converts into viral DNA. That viral DNA will go and sit inside the nucleus, and that will in turn produce the viral RNA and viral mRNA. Viral mRNA produce viral proteins. That and this RNA together will form the virus, which will become released. This is the life cycle. Once more tell me. Virus enters, then it will release RNA. RNA is converted into DNA by the reverse transcriptase. That become integrated into the nucleus. And from that, Typically, mRNA of the virus and RNA is produced, viral RNA. This mRNA produces proteins. That proteins and this RNA combine to form the baby virus that become released. So, at how many levels you can attack, how many levels you can use the drugs to attack these viruses, sister? One is you can use, you can use, you can prevent it from entering into the cell. So accordingly, we use the drugs like enfuvirtide, maraviroc. These are the drugs to prevent the HIV from entering. Then next, the viral RNA need to become viral DNA, for which it should use reverse transcriptase. That is inhibited by all reverse transcriptase inhibitors, which are of two types, either nucleoside receptor, nucleoside reverse transcriptase, or non-nucleoside reverse transcriptase. Then viral DNA is formed. Then this viral DNA should go and sit inside the host cell DNA. That is called integration. That is prevented by integrase inhibitor. Raltegravir is a drug which is an integrase inhibitor. Then from that, the viral genome RNA is produced and viral mRNA is produced. That produce the protein. That protein typically will combine with this RNA and form the baby virus. So that step is prevented by protease inhibitors. Then from that, the mature virus is released. So you should know each of these class of drugs, how do they act under each class, what are the various things. You should be very, very clear, sister. Now, when to start antiretroviral therapy? So obviously, whenever you start retroviral therapy, there is some guidelines that you need to follow. We have NACO guidelines, National AIDS Control Organization. The HIV-infected adults and adolescents who are in clinical stage 1 and 2, you start antiretroviral therapy only if the CD4 count is less than 500. If they are in clinical stage 3 and 4, start antiretroviral therapy, whatever be the CD4 count. Similarly, all pregnant and breastfeeding women, you should start antiretroviral therapy. Whatever be the stage, whatever be the CD4 count, if she is pregnant or if she is breastfeeding, you should start antiretroviral therapy. Similarly, HIV, TB, co-infected person, both of them, both TB is there, HIV is there, then what will you do? You start whatever be the CD4 count, antiretroviral therapy. Favorite question of the examiner, favorite MCQ. If TB and HIV together are there, which treatment you should start first? First to start anti-tubercular treatment, and then you start within 2 weeks to 2 months antiretroviral therapy. Understand, sister? Similarly, for patients with CD4 count below 50, you can start ART along with ATT. But generally, whenever TB and HIV together are there, then you should start TB treatment first and then you should start the HIV treatment. Now comes a very, very important question. What is the dosing schedule for this antiretroviral therapy in pregnant women? Very important question. When you go to all the villages, HIV is rampant. It is present everywhere. So you should know, if my patient is pregnant, how I want to treat. If my patient has TB and HIV, how I want to treat. When TB and HIV together are there, you have to first start TB treatment within 2 weeks to 2 months, you have to start HIV treatment. So if you have pregnant women, Pregnant women require, whatever be the stage of HIV, they should get antiretroviral therapy. So, how you want to, which drug you want to give? Tenofovir, 300 milligrams once daily. Lamivudine, 300 milligrams once daily. Efavirenz, 600 milligrams once daily. You need to start. You need to start while she is pregnant only. Start as soon as possible and continue during pregnancy and even after pregnancy, lifelong is what you should remember. So that completes the first 10 paragraphs, sister. And we have reached to the end of the first class for all of you for the staff nurse exam. Totally in about 10 paragraphs, these 100 points about HIV you need to remember in medical surgical nursing. What is the mechanism of the antiretroviral drugs, etc. So every day we will study together. Every day we become better. In about, you be with me for 100 days. In 200 hours, I will make you the best nursing student in the country with full knowledge. All right, sister. So thank you very much. Please leave your feedback in the WhatsApp group, how you felt about the class. And we keep meeting every day. Thank you.